So it is October 16th and 7:29, and this meeting is called to order. So I guess any additions or corrections to the minutes from last month? So I have a motion to approve the minutes.
Motion to approve. Second.
All those in favor? Any opposed?
Aye.
Aye.
Great. So we can go ahead with the director's report.
Sure. So I thought, I'm sorry for the folks on the line, but you can log in at home and check out. I was going to show the new website. So because a lot of what we did this past month was updating language and migrating content and fixing what they sort of migrated a lot of the stuff over there, and then we had to fix all the broken links and things that looked funny and the text that didn't match up, and so we spent quite a bit of time getting this stuff. But one of the features is just a more modern look. We've got all these different photographs up here that can sort of describe what we have. A stunningly attractive picture. Someone over here. And it just has it's similar content, but just new format for it. We have on the side all of our different programs and information, but things like this we have to figure out. Okay, well that on my screen I didn't never notice that before, but all right, we gotta look at that and see if we have to fix that with things running over. It has some things that are new. Rather than having the news right on the home page where the headlines, now you have to click on it to get these headlines. Which I'm, not my most favorite thing, and then, we just have all the general things here that we've had before. If you want to look up your septic system here, you can do so there. Just pick your street address. And all the other things that we've had, and we've sort of updated all that information and added a bunch of new pages to it. We actually have down quick links over here, so we have the Board of Health. And if you guys want a large picture of Jason here, we can do that.
I think the world is good without that.
That's what we voted on. But it did add, this wasn't done by us, but it was brought over and added. They did add everybody's email addresses here to the list there, and you can all see your terms now.
I'm now actually next.
So David's got one more month.
Yep.
And then Mark, you actually expire as well, but you're eligible for renewal for another term. I hope you stay, but and the Selectmen's office will consider new candidates, and they'll vote on that at the Board of Selectmen meeting, usually sometime in November or December. But so a lot of great new content and a lot of new features. Just these sort of quick links down here, and a new customer. If you want to submit any kind of inquiry to the town, you can do so. You can see you can see what's already been reported. So for example, okay, let's see what's here. Traffic light issues, and street light issues. It's probably more description in the
details.
Background and the details. Let's see if it gives us that. No lights at Fairfield Metro lot across Ash Creek Boulevard. So that kind of thing, and so you can see if the issue's already been reported, so you don't have to report it. The map is a little wonky, you can see, it just switched to somewhere, I don't know where Mount Burnett Observatory is.
What? Only Health Casey Hospital. What was that? That was in Connecticut.
Yeah,
for sure. Some of the hospitals.
Yeah, so it's the map is a little wonky on some of these things, So, but I click here and it goes back. Goes back to Fairfield. Okay. And so you can see, just kind of, so you can see if the complaints have been already reported, so you don't have to bother report it, and there's a functionality to say, hey, I'm going to just add my vote to this complaint and say, yep, I think it's important to redress this complaint as well. And so we're kind of learning the functionality of it, but for residents, you go here, you go to report an issue, you can log in, you can continue as a guest if you want. There's a, way to do it that way as well. But that's where you can report anything you want to the town, whether it's a comment, a question, a service request. So a couple, it had a functionality to do that before. This is just the new system, and so it has a little bit more functionality in terms of newsletters and mailing lists, and so you can subscribe to the health department's news section, and so if we put a new thing up, you get an email automatically that says, oh, here's the latest from the health department, which I'm sure, you all will sign up as soon as you get home tonight. So anyway, this, I spent some time here because this is really one of our significant activities over the last month that just launched last week. And so we were working on it, Andrea and myself and Santina, and then all the staff got trained to make the updates, and then all the staff were reviewing pages relevant to them, and we were able to, and then they would funnel those to us, and we would do them, and I'll just give you one other example, so we created here's a new web page for the Medical Reserve Corps that kind of just goes through all the steps to join. We were able to incorporate, video, links to videos to say,
Hi, my name is Dan Scleary. I'm the Director of the Fairfield Health Department and the Director of the Fairfield Medical Reserve Corps.
And so some, an intro video and we did another one, orientation video, which is, a little bit longer. But just all the steps to take care of it. And so that's an example of we spent time doing this and figuring it out. And, people who change their contact information can update it. That was a functionality, a little survey functionality that they have in there. So we're still working on some of adding new functionality and learning the stuff. So, but it's, this is some of the things that I find enjoyable is doing this kind of stuff and, learning the geeky new tricks that you can do with the new tech. So that was a significant amount of time for this past month for a lot of us. We did have 3 additional meetings related to the Legionnaires cases at the assisted living facility with the state and with the facility. And it appears things are under control right now, so there's been no additional cases since the initial group, and so the state has authorized them to kind of go into this sort of we'll do sort of less regular testing on the systems, and then before the HVAC system that tested positive is actually going offline last week, and then so they're going to be replacing the sand filter in that, and then they're going to be retesting before they go operational again next spring. And so that's some of the conditions of the state recommendation to the state and the CDC. So we've conducted 5 flu clinics so far this season. I have done about 550 shots, 200 of which were the high dose. Our high dose was a little delayed, so that we didn't have it for the first couple clinics, but we've had it for the last few, and we've done them both at smaller clinics at our office, and we did a clinic at the senior center so far. The school nurses will be, in a couple weeks, doing smaller school-based clinics, sort of as they are see fit. It's a voluntary thing. If they want to do a little clinic at their school, they can. And we will do the Board of Ed. We'll do one for the Board of Ed at their facility. So we'll have that scheduled. It's actually scheduled in November. And
what about what you would have expected for attendance so far, or do you think you'd have higher or less?
Well, it's less because when we would typically get all of our doses in September, we would have a big clinic. and we'd promote it and advertise and, saturate our market, which is the senior center clientele, the town employees, and to some extent the public. But so we'd have these big clinics, one of which would go later into the evening. And so those two clinics, we typically do, 600 a day sometimes, and so, but because we are getting the vaccine in dribs and drabs, that we're just kind of forced to do it this way. And so we'll see where it goes. But we will be having some, with the immunization grant, we will have some additional staff come on. And so we'll kind of continue with smaller office-based and remote clinics a little bit longer this season with that staff. But we're also adding things like one of our nurses is going out to Sullivan McKinney Elder Housing and doing that clientele. It's kind of a relationship we developed during COVID. And so we'll, those are some just some not very mobile population. So we'll just go right there. We did have a conversation Jill and I did with folks at Sacred Heart University about having us conducting or assisting with a flu clinic there for the student population and staff there. So we don't know if it'll happen. We just kind of sort of talked about the issues that we would need to do, and that the nursing school there would support providing supervised student nurses to do a lot of the vaccinations. But we're kind of waiting to hear back. We kind of put the ball in their court and have not heard anything from them yet.
And we have the evening one this week on Wednesday from 3 to 8.
Okay, yep.
Well, it's this week, it's on.
Yes, this
This Wednesday, yeah. So we'll have an evening clinic, that goes late for families. We had our annual Fairfield Beach Road stakeholders meeting. This is our annual meeting where we get together with police, fire marshal, health department, Fairfield University, Sacred Heart University, the Fairfield Beach Homeowners Association. There's a couple other associations down there, business operators like the owner of the Sea Grape and the owner of the hotel that's down there, all come and kind of get a chance to hear and work out issues, hear each other's concerns, and it's really a positive meeting. A lot of just good conversation happens. A lot of people being realistic about their expectations of life in that area and the impact of these younger residents that only are going to be there for a year, maybe two tops, and so it's just a challenge as these folks are becoming young citizens and learning to be responsible and going through that phase of life that we all went through, and so, but it's generally a very positive meeting. No big concerns for us in terms of nobody raised any concerns about the health department and our efforts. We've been investigating overcrowding complaints for years. We'll continue to do so. We've already resolved one overcrowding complaint, but in this case it was related to Sacred Heart students up in the north end of town. But again, an overcrowding complaint, and we were able to resolve that. Regarding our grants, I mentioned last month we did not get the preventative health block grant, but we are still waiting to hear on the final word. And I don't think there'll be any rejections. It's just a matter of revisions to any budget types of things. We tried to keep our budgets very simple, and so we're hoping there won't be. But the state has adopted a few years back this core CT contracting system, contracting portal that they've pushed a lot of the contracts through, and the portal is complicated, and we've had several office hour sessions with the folks at Core CT to kind of help people understand how to enter this stuff into the system, and what, especially if there's, uniqueness to your budget that doesn't quite fit in the lines that they provide, the template lines. And so, and we have not heard back from the state yet on any concerns regarding our budget line items, but the state has said we're still, the still probably 8 weeks before they can get to all of them, and so we're somewhere in the middle of that pile of applications. But we at least have received, we waited months to just get the link to log into CoreCT so we can enter our budgets. Then we entered our budgets and submitted those. And so now we have to wait and see if there's budget revisions that they want. And then we did actually, as I mentioned last month, we applied for and we got approved for our per capita grant, and we've actually received all the funding for that already. So that's good. We're moving forward with that. We've already hired the staff on that grant, and that's a big help to the department. And then we continue our transition. We finished our phase 1 of our database transition, which is sort of us uploading and providing all the documentation that's critical to us for this new permitting. It's going to manage our permitting, and our licensing, and our certificates, and our complaints, and several of our environmental issues. So that will, we've kind of uploaded all of our applications and forms and documents, and tried to get them to understand the workflows of it. And so now it's on them. The next, what they say, Andrea, 2 or 3 weeks, or a month, I think they said.
Right, I think they
4
said a
weeks.
month, and then
That they'll figure it out on their side, and then they'll come back to us and say, all right, here's what we did, and now review it again, and we'll make tweaks again, and then after that, we will do an initial sort of go live in the system.
Thank you.
So we'll continue to meet that with, with that company that's working on that, and with our IT department for that, and that is my report.
Thank you very much. Yeah. Joe, you have
Any questions?
any questions about any of that? I think that's great, actually. The website looks great.
Yeah, it has a lot, it has a little more pop to it, but I just feel like sometimes I say, like you're kind of taking up about, half of the page with pictures, so it forces you to scroll down to get to any of the meat of the website. But I do like the pictures, it does pop. That's one of our COVID clinics.
Mm-hmm.
Yeah.
You're getting the big clinic.
Pictures are good. That's great.
Start
Thank you,
switching.
Ann.
Yeah, I know.
So Jill, you're
Yeah,
okay?
sure.
Thank you.
So I just have a few things to bring you up to date with. I think that the last time I was here, we talked about the part-time staffing for 2 elementary schools. Well, that was filled. Started off fully staffed over back in August. Unfortunately, one of those nurses at one of the elementary schools had to resign for personal reasons, and she's only even less part-time than she was, and will be working for us as a sub until a few things get straightened out, but it'll be fine. It'll all work out. So what we have to do, though, is continue to monitor those 2 schools. I mean, they are very busy, very, very busy, and so we're just going to keep on assessing that in terms of office visits, the type of office visits, any more procedures that are done. So far, it's remained somewhat stable, but, the year is young. We always still need to build up our sub pool. We've hired 3 subs in the past 2 weeks. They're going to be orienting this week, as a matter of fact, and I'm interviewing 3 other applicants, and I think we'll go forward with those as well. Let's see. We've had 2 staff meetings so far. We're really not trying, but it just worked out this way, focusing more on training. In one of our staff meetings, we had, for the public school nurses at least, we had someone from SPS IT come in and do some training on Parent Square. And those of you who are parents in the SPS system know about that. And it's not particularly intuitive, but I think as people get more experience with it, it'll work out very well.
It's actually pretty nice, yeah.
It is, yeah.
It replaces communication from Infinite Campus.
Oh,
But what it really
we just left
was
that.
really helpful.
So like here's my principal today. It's like this for Veterans Day. Here's her post. It's got pictures. You can like her little newsletter on there.
Oh, very
Yeah,
nice.
it's pretty nice.
Yeah.
And you can like instant message back and forth with the teachers and
Oh.
other real-time communication.
I'm sure they love that.
Nice, yeah.
What's, and I get them from all of the schools, so.
Poor
I
Deb.
wake up to 18 emails.
Oh, my
I'm
gosh.
like, oh, my word. But what we think will be really valuable to us is that parents can receive all of our messages, our letters, in the language of their choice. And they can write back to us in their language and have it translated
Wow.
for, primarily English speakers in the nursing department.
I think there's
So,
like 60 or 80 languages in there, right? That's what
Oh,
our
I
schools,
would-
there's a lot. I mean,
yeah,
you name it, that covers it.
yeah, I
Yeah,
mean, things
really.
I've never even heard, dialects, I mean,
Yeah.
just everything.
It's really cool features.
And it's a good thing. We're not, typically in these families, we often relied on the children to be the translators, and that's a significant burden for them. And I just think we get our communication on a healthier level, really.
But I would add, for critical things, we have a translation service that we call, and, so if there's, medical documentation that needs to be translated, we have a service that we don't always rely on
Yes.
the children. We rely on professional translators.
No.
To translate critical
When we got the
information.
letters home, Sans, we were never able to get translations of those letters going
Yeah,
home. I
yeah.
never pursued that. When patients came to us and I didn't understand their language, I would definitely use, what was it?
Cyricom.
Cyricom, yeah. And one thing that we have found, and we were discussing this just today, is the amount of immunization records that come in foreign languages. And we certainly need some help with that. We did have Cyricom translate some of them, and when you talk to them live and have the patient with you or the patient's family there, it's very easy and relatively inexpensive. But translating documents is a bit more burdensome for us, so we'll work on it though. Let me see. Oh, the other training that we've done, we had one of our school nurses, Joanna Ogorzalak, Julie McCullough, and of course, Santina Geronko come in and train all of the nurses on QPR, which I'm sure she explained to you in previous meetings, the question, persuade, and refer when you're dealing with people who are potentially suicidal. And the training for that, it really just gave us, it was very engaging, and it really just gave us the language that we can use to start those conversations with individuals, students, staff, friends, anyone who we feel might be at risk for that. Very, very valuable, really good feedback on that. While we did the Parent Square training with the public school nurses that week, private school nurses don't use that platform. So we had the Norwalk Community Outreach Program come in and train them on Stop the Bleed program. Most of our private school nurses are relatively new nurses or new to the school system because they're basically part-time positions. So most of them did not have it when we did the Stop the Bleed training a couple of years ago. So it was really valuable lesson. And we're going to use them again for additional training, follow-up training. Talking about immunizations, with the start of school, we found that immunization compliance continues to be a very difficult problem. Despite the directives from DPH last year, despite the elimination of the religious exemption, we still have, I can't say many families, there are a few families, but they do present a difficult obstacle for us to get the children compliant and into school. We have offered to give them CDC and DPH compliance schedules. We offer vaccines at our department at a minimal cost, at no wait. Just come on in and you can get the vaccines, but they still are reluctant. We were able to identify one practice in particular that has caused problems for us because their policy is to administer one vaccine per month, which, as you know, if you start at the age of 4 or 5, it's going to take you a very long time to catch up on your vaccine schedule. This practice does not affect only us in Fairfield, but it's really every nursing supervisor in our group has had experience with it. We did petition DPH if we could file a complaint against the practice, and they said that since we were not consumers of the health care, that we really didn't have a leg to stand on with the practice. I've spoken to the practice themselves, and they were just absolutely defiant and will continue to hold to their policy of 1 vaccine per month.
Is it a pediatric practice?
It's a pediatric practice.
So they don't,
How is that?
yeah, I mean, don't they follow the guidelines that?
No, they don't.
That's, okay,
Yeah.
I don't know how that's
that
possible.
doesn't make any sense.
So they take one of their parents to complain before DPH would
Yeah.
look into it.
Yeah. And, you know, the parents, I've had parents tell me, we really like this doctor, we like their
Is it-
approach.
Is it a single solo practitioner, or is it a?
As far as I can tell, last year there were 2 MDs and a number of APRNs. This year I've only seen 1 MD on the letterhead.
And what does the state require for, I guess, school entry? Do you have to be in the process of actually getting them?
You
or do
can
have to be-
actually, yeah, you can be in the process.
So that's sort of what they say then, well, we're working on it.
But
Yeah,
it's not
exactly.
but it's not the process. You're given a 30-day, you know, you have an expiration date being in process. You have a 30-day extension after that. And, you know, we will allow that. You know, I understand people don't want to give their child, you know, 4 or 5 injections at a time. We really make reasonable schedules for these kids. We have gone and gotten, which we usually don't carry, accommodation vaccines, and I've borrowed them from other pediatric practices, you know, vaccine transfer, it's all very legitimate, just so that we can give 1 less shot to these children, and the reluctance is still there. Yeah, it's really unfortunate. So, yes, and you know what also happens? So they say, we'll even say, okay, you've got an appointment October 18th, great, give us the result on October 19th, and then we call, and, you know, gee, the doctor didn't want to give it, he had the sniffles, I didn't want to take him, he was too ill to get the vaccine, so, you know, and that happens next month and next month. So that's been, I mean, I'm being very frank about it. It is a huge time waster, to tell you the truth, you know, trying to chase down these people. We don't want to keep kids from school, I have to tell you. I mean, that is the last thing I want to do. But nonetheless, you know, in some instances, we're not holding them compliant, holding them responsible for
Is
their
there a chunk of the
children's
kids going to this practice in town?
No, I can't say,
No.
no, absolutely not. But
But still,
you have a number, and it really
Yeah.
takes up a lot of your energy trying to get, you know, I want our immunization compliance rate, you know, to be the best in the state, but I don't think it's going to be that way.
Well,
It's too bad.
Any ideas?
I
Let
wonder
me know.
if other pediatric theory, if another pediatric or several of the other pediatric practices in the town could file a formal complaint to the state. I mean, this is not something that.
I haven't pursued that. You mean like a peer having a?
Like, do they
Yeah.
know, do they know about it? Do they know that, they may know that this is happening, but this is not,
Yeah.
it's not, it's in the, it's
not unsafe
not
practice.
it's unsafe.
I've offered,
The children.
I got 1 letter, the child was supposed to go in, I got the letter the next day, and it was, he had a potential autoimmune reaction. So I said, okay, well, that's a medical exemption then. You can, you know, fill the paperwork out and sign it, and they absolutely refused. They said, oh, no, he has to go to I'm not going to say anymore, but he had to, you know, get another referral.
sure.
So,
That's really terrible.
yeah, it's really very hard.
Yep.
So let me see. I guess that's it. If any of you have any ideas, maybe I'll talk to the office managers of other practices and address it that way.
Yeah. I'm gonna.
But if we don't have standing, I'm guessing that with DPH to make a complaint, if nursing supervisors don't have a standing,
Yeah,
I'm guessing that they
Yeah,
won't.
probably
I think you
not.
get enough people kind of together, DPH has to listen at some point.
Yeah.
You know, especially if you find the right person up there, but
yeah,
that's still a hard situation.
I mean, the guidelines are there for a reason,
Right.
so everybody kind of is
Yeah,
uniformly
just
following
protecting the
them.
children, I mean, I think that it's
Yeah.
certain things that I
So
understand.
we have, you know, we have this mandate and, you know, we don't have too much with which we can enforce it, which is frustrating.
Right.
Interesting.
Thank you, Jill.
My next thing is that we have a new school in town, and this has, this is okay, Sans, if I discuss this?
Very anonymously.
Oh, yeah, okay. So we have a new school in town. It's a private school, very small, and we have to provide services in kind according to law. And it turns out that we have to provide a little bit more than just, you know, checking vaccine compliance and health assessments and training teachers to medication when we're not there. It's a very small school, less than 30 students.
Is that the one that's at Holy Family?
Yes, it is. Yeah, it is. We've had to provide more nursing services there than we anticipated, and it's proven to be, you know, a significant drain on my sub-staff and even on our office staff down at Public Health Nursing. I mean, I've been there trying to give care. The two nursing coordinators are there nearly every day. So it's challenging, and so we've tried to do what we can as far as student and staff teaching. It's not working out very well. And we've just had to, well, we're in discussions with finance upstairs about just providing some part-time coverage for the school.
So that's the requirement, every, private school is also entitled to,
They're entitled, yeah, they can ask for it.
but most don't, is that what happens?
No, I would say most do.
Oh, they do, okay.
Yeah, most do.
So it's just unexpected to you then?
Yeah.
And it's the town's responsibility to, so it's, being that it's a private school, they don't employ the nurses themselves?
That's right, they don't have to.
So just like the town provides special ed services to private schools, the town provides nursing services to private schools.
Wow, okay.
But it's based upon, you know, what would we provide a public school of that equivalent student population?
Right, you got 30
One
kids
nurse
and now
for, yeah,
one
now
nurse,
you have a
yeah.
whole nurse for 30 kids.
Yeah, so we don't necessarily provide full-time coverage for these private schools, but based upon, and that flexes, so based upon the conditions of those particular student body may dictate higher demands upon nursing, and then we have to provide adequate coverage, in-kind coverage that we provide in a public school to a private school. And this is a situation where
Is it location-wise
provide
near
additional-
another school of ours, public school, that, there could be a?
Yes,
an
and we have
on-call-
taken advantage of
I was just
that,
gonna have an on-call nurse that maybe can hop over there. I'm sure that
yeah.
she or he doesn't
Yeah.
want that, but
well, that's what Jill has been doing this fall, is sort of experimenting with a variety of techniques to see how we can best provide
Right.
coverage and see if education can do the trick, you know, with conditions that can be managed.
Yeah.
And so as we've done before in the past, we're asking for some sort of interim additional staffing, so we'll
Yeah,
do
no,
that
this
process.
is the first time it happened, but,
Yeah.
you know, how much we need nursing staffing in other areas, it's interesting how it's
Yeah.
working out.
Is there a reason, I mean, is it anticipated that there will be a continuing need for more than in terms of the nursing to student ratio at this particular school at an ongoing?
Well, certainly the numbers will increase, because they just have 2 grades in there now. Next year it's going to be 3 grades, the year after that 4 grades, and I think it'll top out at that. It's a wonderful program, it really is. And they were like, what, we're going to have to be here all the time? And, you know, they were just as surprised as we were, but they didn't identify these needs until we got there.
Very.
That's it for me? Oh, yeah, that's it for me in my report, yeah.
For now.
Yeah. To be continued.
Thank you very much, Jill. I guess, were there any communications?
I have none.
Anybody? I did not get any this month. Is there any old business that anybody wants to talk about, or unfinished business, any new business?
So Jill, that's you, is
Yeah.
new business.
That's right. So the new business is a proposed policy change regarding naloxone administration. And we do have the old policy here. We wrote it back and approved it. The board approved it back in 2017. And it was really for nurses to administer Narcan, naloxone, to individuals suspected of opioid abuse and overdose. We did that really just with Dr. McDonald's standing order, and, thankfully we haven't had to use it, but we were among the first in the state to do that. Last year, I believe it was last year, time goes by so quickly now. I think it was last year, we were told that we could expand that to staff, teaching staff, to administer it to, provided they received the training. So we had someone from, it had to be 2 years ago, we had someone from the fire training school and the EMT service up at Yale come down. And I decided to target all the high schools and the middle schools, and all of those staff have access to Narcan. We keep an extra Narcan in the AED so that they could administer it in the absence of a nurse, or if they, as quickly as possible to administer it to someone. Then just this past year, the legislation was changed, and they want access to naloxone in all schools, and and we actually added the after-hours component to it, because the nurses aren't there after school hours, and we have parties and band concerts and sports activities, and we have parents visiting, and a whole number of scenarios in which we could have, this situation occurring. So we just thought it was best that we include the after-hours scenario, and make it really accessible at all school levels. So once again, my great nursing supervisor group, we got together, and we actually proposed some regulations to our supervisors, superintendents, and we came up with the administrative regulations and then a policy. I presented it last month at the Board of Ed, and it was approved with really, I think, with typographical errors, not much question. And so I'm presenting it today to you, really as a Board of Ed policy for your approval. So I don't know if you had any opportunity. It's much more comprehensive than the one that we wrote a few years ago. But if you have any questions about it?
My only question is on the opt-out. I guess I understand that parents will be able to opt out of anything, but the reality of it is, how effective is that going to be? No one's going to go to the office and pull, okay,
Yeah.
well, Johnny opted out, let's not give him Narcan now.
Yeah.
I mean, in an emergency, he's going to get it, is the reality of it, right? I mean,
I think that is the reality of it.
and either way, EMS will show up and they'll administer it, so either way.
Oh, you hope so.
Yeah, right.
I think that we talked about that, and we were saying, why are we doing this opt-out? Believe it or not, we have an opt-out for EpiPen administration to the unknown as well. I can't imagine, I don't have anyone who has opted out on that, but I'm not even sure that parents are totally familiar with the opt-out option. With this, we were obligated to include it by the state in our policy. There was no way we could get around it. And we'll have a statement in there, and we'll make parents aware of the policy, and they can read through it and choose the opt-out if they like. We did think about operationalizing this. We only have, a small number of staff that would be available to administer it. And I can imagine an even smaller number of parents who would have their child opt out, and to make them aware of it. But I doubt that I would be able to refrain if I truly believed that the child was
So
suffering.
if something were happening on the spot, are we going through their file to see if
No,
there's
I think it would just be, these are the names of the kids in your school, and that would be it.
So it's almost, they would almost need like the opposite of a medical bracelet, an opt-out bracelet.
Yeah.
Way.
Right.
Right.
Yeah, no,
Like, how would you know?
How are you gonna know right away? You're not
Yeah.
gonna memorize
So,
the list.
Right.
It's more of an ask for forgiveness later
If
situation.
there's any evidence
Yeah, I
that
guess
somebody is having
Right.
an opioid overdose, unconscionable not to do it, so they
Yeah.
can't not
Yeah,
do
who
it.
would
But I think also
actually
as part of,
suggest
education for parents to realize that this is, you know, a safe drug, it is a super safe drug. And, you know, if your child, we're not saying that your child's a potential for drug using, but it could be accidentally injected.
Mhm.
And you don't want to prevent that, prevent your child from not having access to this life-saving drug.
Mhm.
Yeah.
So again, it's the whole parent education part of it, just
Right.
to take away the stigma of it and just let them know. I mean, this is, you know, New York City, their health department, I was in the city over the weekend for my son's wedding, by the way.
Oh, congratulations.
Thank you. And we were hearing ads like the commissioner wants everybody to have a Narcan in their pocket. Now, admittedly,
Yeah.
Fairfield is not, you know, New York City with all the attendant problems they have, but still, you know, it's
Yeah.
kind of the way of the future.
Mm.
Yep, I've heard advertisements for it also, like,
Yeah.
get it to everybody.
Yeah,
Like,
yeah. Well, actually, it was those two cases of the high school student and the middle school student. And as I remember, the high school student, the nurse administered Narcan, I mean, it's further up in the state. And the junior high student, I don't know if he did expire or not. But I heard that, and I said, okay, we're going for this. Everybody can have access to this in the middle and high school. You know, it's not, the dose isn't weight related, I mean, it's nothing
No,
like
it's
that.
right,
It's-
right.
It's a really safe drug. So I don't know if you had a.
Jill, I have a question on
Yes.
this. So are you changing the health department's nursing policies related to this? Or are you seem to indicate that you're asking for approval of the second document, the Board of Ed policy,
Yeah,
which,
well, I think that this,
or are you just asking for
I think-
review of this?
I think this new one supersedes our old policy, so I would ask for a change to this policy and eliminate this. I don't know what you do with an old policy.
Okay, so, yeah, I mean, this board doesn't approve Board of Ed policies. We
Uh-huh.
review them when they're related to medical issues. If the board had some concerns about that, we would bring those to the policy committee, those concerns, and they would
Yeah.
work to address those concerns. But we don't approve Board of Ed policies.
Mhm.
We
But
approve Fairfield Health Department school nursing policies.
Is it just reviewed by?
So, yes, so then if you're asked what, yeah, that's the clarification. We don't approve them, but the Board of Ed the Board of Health can review this policy, and if they have any concerns, to bring them to your attention, and you can bring that back to the Board of Ed for their consideration.
Right.
So this one's not changing at all then, the Town of Fairfield Health Department, Narcan administration policy, because that's separate, or is the one that we reviewed replacing this one? 'Cause that would be very much to your
I
point
think
then.
everything that's in here is addressed in here. It
Okay.
addresses the nurse being able to administer it, and that's what it really is.
Is this dated 2017 document been updated to reflect that? To reflect the changes in the Board of Ed policy?
No.
No, okay. So what I think we need to do, and you can correct me if I'm wrong, is update our policies based upon this and bring that back maybe next month or in a subsequent month, based upon the change in the Board of Ed policy and the change in the state regulations. The board is free to review and make comments, and we'll capture anything and forward them on to the policy committee to the schools. But again, we wouldn't vote to approve this policy because we don't approve Board of Ed policies. We approve health department school health program policies.
So the county, we have duplicative policies in both, I guess, policy manuals then, is that how that?
We have policies that the school nurses follow. That's what the health department and this board approve. The health department develops them, this board approves them and reviews them. The school has their own policies that they review and approve, and they often, and in most cases, when it has to do with health, consult with Jill. And Jill will consult with Dr. McDonald if necessary, and then with this board if necessary, to make sure that nobody has any concerns about moving forward with that policy with a medical component to it. I think if the existing town school health program policy needs to be changed, then we should update that
Okay, well, I'll just incorporate that in.
Yeah, exactly.
Yeah, different letterhead, I guess, that would.
Yeah, I mean, 'cause it's, you know, like when I looked at this, it says, oh, this is a Board of Ed policy, not a health department policy. So.
Yeah, I have to see, Sam, because we may have some policies that were approved by the Board of Ed, let's say for vaccinations that come down from the Connecticut State Department of Education or health assessment mandates. And I think that those are in our policy manual just as, you know, approved by the Board of Ed, reviewed by the Board of Health. So let me just check that. And if it is that,
Yeah.
whatever way it is, you're gonna see it again next month, okay?
Sorry, yeah, I just, you know, want to be clear that, because the attachments clearly mark it as a Board of Education policy guide.
Right.
You know, and so, our, you know, as I said before, we review those, but when requested, but we don't approve them.
Okay,
Okay?
so that's table for now, I guess.
Well, I would say it's, the board can review it, provide any comments if you have any, or if you, want to review it further, provide them to Jill, for referral to that, and then we'll come back with the updated health department policy.
Okay,
Okay?
Great. Thank you very much.
sure.
Any comments? Anybody who's on the phone, any comments about what we talked about here today? No?
No, I don't have any comments.
If not, I guess, do I have a motion to adjourn?
So moved.
Second.
All in favor?
All right.
Aye.
8:15.
Meeting-
Sorry to take away your thunder, Jill.